Let me start off by giving you a real life example of why it's so important to have a conversation. And the example I'm going to give you has happened to me countless number of times and to other ER docs as well across the country. Okay, you've got grandma being wheeled in from home. She's 94 years old. She's being cared for by her two daughters by ambulance because she's not breathing well and she looks like she's deteriorating very quickly. She's not conscious and she has advanced Alzheimer's. Or some form of dementia. She's been bedridden. She's 94 years old. And the ambulance wheels her in and the two daughters follow her. And I'm there to talk to the daughters and take a look at her. And you do not need a medical degree to see that she's close to death. And I get the information from the daughters. I've never seen this lady before. And the daughters say, yeah, this is mom. We're concerned she has pneumonia because she's been coughing and we notice she's hot to the touch. And this medically, technically is an end of life event. It just is. In the old days, we used to call pneumonia the old man's friend. So I talk to the daughters. One of them looks extremely distraught and the other one anxious, but not that distraught. And I say, okay, mom's not looking well. She's not breathing well. Her oxygen levels are low. If we're going to treat her aggressively, she needs to go on a ventilator. She needs to go on a respirator. And I need to know what her wishes are. Does she have advanced directives? And the two daughters both shrug their shoulders. No, she doesn't have advanced directives. I cannot talk to the patient because she's semi-comatose. And I said to the two daughters, do you know what her wishes are? And one daughter says, quote, do everything. Do what you have to do. I don't want to lose my mother. Please do it. Put on a respirator if you have to. And then the other daughter says, you know what? She and I once spoke, and she told me that she'd never want to be on a ventilator. And I realized that you have these two daughters with completely opposite perspectives of mom, who's clearly end of life. And now I'm in a situation, I got to make some kind of on-the-spot decision, what we're going to do. It puts me, the physician, in a very awkward spot because there are no advanced directives. The topic was never discussed. It clearly was taboo to discuss it, I would think, which is very common, by the way. People don't want to talk about end of life because it's a difficult taboo topic. Fortunately, in this case, I was able to find out that the daughter who said she really didn't want to be on a ventilator was in fact her power of attorney. She technically was. And I was able to tell the other daughter, if these are her wishes, putting on a ventilator, unfortunately, is not going to save her. She is close to the end. I think we just need to make her comfortable. But it was a scenario that became high stress, high anxiety, that could have been avoided if the family and the patient ahead of time talked about having advanced directives, talking about what their goals of care and wishes are. And when I hear that patients do have advanced directives and I know what they wish, it makes my job so much better, so much easier. And of course, the outcome for the patient family is so much better and so much more serene and peaceful.
Starting your route to retirement.